From across Maryland, Virginia, and the District, this is Washington's 24-hour local news leader. News Channel 8's Live This Morning starts right now.
Back at 10:53 on this Wednesday morning with news from medicine's cutting edge. Osteoporosis is often viewed as a disease of women, but it turns out almost 2 million men over the age of 50 have been diagnosed as well. Dr. Hanson Channel is with the Washington Radiology Associates, and she joins us now live here in the studio with more on how osteoporosis, that thief of bone, if you will, ought to be on men's radars as well.
Oh, absolutely, Dave. It's one of those disease processes that's silent until it's too late to get a fracture. It is a process that can be prevented. It's easy to check for it. Years ago, we didn't have any medications to treat it, so why bother looking for it? But now we have medications that can prevent it and treat it once it happens. So it's an easy test to perform to find osteoporosis.
There is some good news to talk about osteoporosis in men. We know the warning signs in women and who is predisposed to the disease. Who is similarly predisposed for men?
Similar factors. Age is the biggest one, especially over 70. Sedentary lifestyle where they're not as active. Decreased body weight or a loss of weight, substantial weight in the last few months, testosterone levels going down, certain medications they're taking for chronic diseases such as steroids for asthmatics really set them up for significant bone loss.
I tell my daughter that I want her to drink milk because I'm trying to add to her bone bank, if you will, to make deposits when she's young so that she can make withdrawals later on. I guess I can use the same argument on my son as well.
Absolutely. And they should start young, start as adolescents, because the better they build their bone mass, you're absolutely right, they can withdraw later. It's a disease process that is a normal thing. Bone constantly is rebuilding. There are certain cells that tear the bone down called osteoclasts, or cells that build it back up called osteoblasts, and that's how we can repair a fracture when you injure yourself. But that process goes awry as you get older, and you start tearing your bone down more and building it back up less. And so when that gets ahead of the game, that's when you get osteoporosis.
Now, we talked about sort of the generalized risk factors for it, but there's some other things. You can take steroid drugs, which a lot of men get prescribed for certain things as they age, that also raise their risk as well. Absolutely.
Medications like steroids reduce your bone mass. Many times asthmatics as they age are on steroids. You're decreasing testosterone levels as you age. Just like in women, as their estrogens go down, same in men.
We would sort of routinely treat women of a certain age for osteoporosis. Should we be doing the same thing for men?
Absolutely. They should be screening beginning at age 60, 65, definitely no later than 70. And if you have a life-altering event which changes how well you are maneuvering in terms of you're more sedentary, you should be checked sooner. If you have a strong family history of osteoporosis or fragility fractures, or have had a fracture yourself, say you had a minor fall and all of a sudden you have a broken arm, that's a good little tool to tell you to get checked.
Clearly, we need to readjust our thinking on osteoporosis. It is not just a women's problem. WashingtonRadiology.com for more information. Hanson, thank you so much. We're right back. Hope you are too.